will be some of us may want to start a new palliative care service. So we may not be knowing what all we need to prepare it for, and what are the resources required, how can we do it, etc. So this session will give you an overview regarding how to organize a palliative care service. So the session will be facilitated by Mr. Binod Hariharan. So basically, he's an engineering graduate, and currently he's MD of two companies. But he has been with Pallium India since its formation, and he's one of the trustees of Pallium India. He's a good person to talk to you about how can we organize a palliative care unit. So welcome, Binod, and it's over to you.
Thank you, Dr. Sunil, for that wonderful introduction. I hope I am audible.
Yes, sir.
Yes, sir. Yeah, you are audible, but I think the voice is a little bit on the lower side.
Okay. Okay, let me see if I can add headphones. Thank you very much, Dr. Sunil, for that wonderful introduction. So, as Dr. Sunil said, I am trained as an engineer. Been involved with palliative care as a volunteer initially, right from the beginning. Right from the beginning, and in the sense when this whole concept started off in Kerala, in Calicut, in fact. And now I'm also a trustee of Pallium India. So, good morning, good afternoon, good evening. I understand there are at least a few people who are joining in from other continents as well. So, let's jump straight in. I believe that Rajalakshmi had shared a few slides with all of you. So we are not going to go through those slides one by one. Rather, we'll make it more kind of a discussion. And of course, if you have any questions on those slides, you can raise these questions, and then we'll probably have discussions around that. So, as Dr. Sunil said, what we have seen is many people go through this training program of palliative care, trying to understand how to handle the pain and other symptoms when it comes to managing a palliative care patient or a chronically ill patient with life-limiting illnesses, as we say, or like debilitating illnesses and all that. So that part is, I believe most of you have gone through that those sessions. But then as medical professionals who are on the other side, where you're supposed to deliver care to these patients and families, what we often see is most often you don't have a system which supports this kind of healthcare service. For example, you may be in a hospital environment where there is no palliative care training being offered to professionals, including nurses, social workers. The whole approach may not be conducive. There is often the situation where you don't have the kind of medication, or the medicines are not available, including opioids, to treat pain and similar symptoms. There are often situations where your own team members, teammates, it could be other doctors, nurses, social workers, they don't have a background, and because of which, most of the things that you would like to see implemented may not actually happen the way you want it to. So these are the real life challenges, and we cannot run away from them either, right? So the idea behind having this session on organizing palliative care is to look at those aspects, the practical aspects of um, implementing palliative care or integrating palliative care into your own settings. When I say your settings, it could be a hospital environment, it could be an independent clinic, it could be a palliative care center which is run by an individual, or maybe an NGO which is running it. It could be a government setup also. So it could be different. And I'm sure you all come from different backgrounds. So what we'll do is, um, I will start off with a question. So I'll give you a scenario, and probably you could step in and give your comments, and your suggestions on how we can go about handling that particular situation. And probably we'll jump to a few of those slides for reference. I hope everyone has been able to get those slides. Is it already shared, Rajalashmi?
Yes, sir. We already shared it by 12 o'clock. I am not pretty sure how many could read it after that time.
Okay, fine. Okay, so let me start off with this scenario. Um, Imagine your neighbor, in the sense, you're in a house nearby where you stay. A lady with maybe a couple of kids crying out loud in the middle of the night. I'm just giving a scenario. In pain, and this continues for days. You can hear those pains, scream. You can hear those screams, and then you wake up in the middle of the night hearing those screams. What would you do about it? I mean, what would be the likely steps that you would take? How would you respond to that situation? Of course, you can use the chat window. You can put in whatever your opinions, comments, and of course, you can use the microphone. Only thing is, restricted to one person at a time. That's all. So comments are welcome. So I'll just give you the scenario once again. There is a neighbor, a lady with two kids, whom you know, in terrible pain. You wake up in the middle of the night hearing her screams, and this happens for days together. What will you do? How would you respond to that situation?
If anybody want to speak, please unmute and speak,
Yes.
or else you can give your comments in the chat. Dr. Parul?
Yeah. Yeah. Hello, everybody. Good afternoon. As he has told us, it's the middle of the night with kids and a family, and we don't know what is actually going wrong with her. So probably what I would like to do is go on the next day, probably when the kids are busy with their school and the husband is gone for work. I would like to talk to her, like, what is troubling her? What is the source of her reaction? Like, if it is a physical symptoms or there is something else which is troubling her, and try to talk to her. So this is how I will know what is troubling her based on whether it is a physical symptom or there is any other social issue which is going on. And then probably we can discuss and try to sort out the things. This is the initial step because we really don't know what is going on.
Yes, absolutely. Thank you, Parul Dubey, right? Yeah. Thank you. Yes, you're right, and I can also see a few others who have responded. Namrata has said, talk to her. What is the problem? Shirley says, find out what is the actual cause for the screen. Yeah, naturally. I mean, if uh, I mean, that's a natural human tendency, I believe. If you hear someone screaming or in pain, or you find someone on the roadside, fallen down, ask her if she would like our help. Yes. So that would be the next step, right? So first is understanding what the real problem is. Now, what if, imagine it's me. It's not one among you who are already trained as medical professionals. I don't have a medical background. So what should I be doing? I have this patient or this person in pain. I hear her screams. I don't have any background. What do you expect me to do?
Still try to find the cause.
Okay, talk to her.
Yeah.
So, yeah. So I hope everyone agrees with Parul on that. Why I ask this question is,
Yeah.
um, now I don't belong to your community. I'm not one among you, or at least I'm not considered as part of the medical fraternity. I'm not trained. So when you say that I should still go out and ask her what the problem is, you are inviting me into your community. Am I right? You expect me to be involved there? Response? Yes.
Yes.
Thanks, Shirley. Thank you for letting me in. Because if not, I don't have a role here, sitting here talking to you. The reason why I am here talking to you is because you have led me into your, as at least considered me as part of your community, even though I don't have a medical background. And that I believe is the first big step. Getting the community involved, letting them in. And I can be trouble for you. Please understand that also. It's not going to make things easy for you because I'll be asking very, very stupid questions, complicated questions. I might even make your life miserable. Are you okay with it? I can see at least a few people smiling. You're okay with it. Thank you very much. So if you are clear about it, welcome to the world of volunteers, the community being involved. So you're asking the community to be involved in medical care, in healthcare. That is a big step. And I believe that is one of the fundamental things that we have seen change in Kerala over the last 3 decades with the advent of palliative care or palliative care being practiced by more and more professionals and being accepted by the community. So it's that's fundamentally the first point which I wanted to highlight. That is, who should be involved in healthcare? And you can, I think I'll share that slide. Um, I'm sure you must have seen it already, but then just in case. Or would you like to share it from your end, Raju? Could you please?
Sir, a few minutes, sir. We will surely share it, sir.
Okay, fine. Okay, so let us move on. Let us move on to the next step. Ask her if she would like to be taken for professional help. Okay, Nirupa mentioned that, we, I believe it is for me to ask her whether she would like to get some help. Obviously, um, her response would be, I assume, yes, I would like to get professional help. I am in pain. I need help. What should I do now? How do I go about solving her problem? Now, I am in a situation where a person in pain, in suffering, has asked me for help, and I am an engineer, or at least someone with engineering background, who has got no idea about pain, its symptoms, or how to assess pain, what are the kinds of pain that we're talking about. I have absolutely no clue. So obviously, if I need to get help for her, what should I be doing next? What do you expect me to do?
Find out if there are pain clinics nearby and guide you.
Yeah, thank you, Rama. Yeah, Parul, you have something to add?
Yeah, just to add that, like we all are here because many of us are from the backgrounds where we probably don't have pain clinics. So probably taking her to a community health center or a PHC and volunteering her to take, and any general physician can evaluate and see what can be done on that level. Any medical personnel, like somebody somebody workup, and whatever can be done on a local level rather, yeah, rather than more specialized clinics. I would say we probably, since not all volunteers can be from the medical background.
Okay, wonderful.
Yeah,
Thank you.
this
So
is
I
my
have,
opinion.
yeah, thank you. Yes, absolutely. So Mr. Gopal has something interesting to say here. He says pain is not always treated by medicines and doctors. Thank you, Gopal. You have made a very valid point. So before taking that person to a typical pain clinic, when we say pain clinic, we refer to the uh, physical condition of pain. Often we ignore the other emotional pain, and I'm sure you have gone through all those, the total pain, the concept of total pain, and all those things. So we'll not go deep into that, but yes, so it should be at least someone who can understand pain as we understand it now. Someone who can look at it from different perspectives and try to understand what exactly is the pain that this patient or the family is going through. And it need not necessarily be doctors, but definitely, yeah, if it is physical pain, you need to get professional help from a trained medical personnel. Ask her to see a general physician. Absolutely. Namrata, thank you for that. This is another thing which we often miss, right? Especially in India. We are in a world where we want all those specialists, the super specialists. If I have a running nose, I would rather go and meet the ENT than the general physician. If I have a stomach upset, upset stomach, I would probably go and meet what do you call what is the name of the professional? Uh, Gastroenterologist or whatever. So we often don't take that other route of seeing a general physician, taking that general advice, and then going and meeting and this thing. So, as the wise man says, do us our bit, do our bit. Yes. So these are all things which are possibilities, but the first step is to understand, to get a sense of As someone mentioned, I think it was Parul who mentioned here that most often you may not even have a proper facility nearby, like a pain clinic or some other palliative care center. We may not have access to that. So that is where, like Gopal said, we can always still do our bit. And that is also very important. Sometimes it would be just listening to that patient, spending time with her, trying to understand her problems. Even that helps. I'm not saying professional help should not be taken, but if even that is not possible, still there is something that we can do. And that is again another basic principle in palliative care. I'm sure you've gone through it. There is always something that we can do. There is never a situation that nothing more can be done. We can still do it. So here is the next situation. Okay, that person identifies a proper palliative care clinic or a pain clinic or whatever, at least a general physician. And then what do you expect that person to do? I mean, pass on that information, give the guidelines, the what you call the contact details, and ask the patient to contact the doctor. Is that the what is expected out of the patient, or me, if I am in that situation, do you expect me to do something else other than that? Of course, I can pass on the contact information and ask that lady to call the doctor. I can do that. Anything else? Inform husband, family members too. Yes. If they're not around, yes. If they're around, that makes things simple. So beyond that, do you expect me to do anything else? So the patient is still in pain. She is at home. She has these two kids to look after. And we understand that she needs medical help. And we know that, okay, it is available at this particular location or this particular palliative care clinic or pain clinic or whatever. Ensure we follow her up with help. Yes. So here is the situation. Now, I go to a doctor, and this lady whom I am referring to, I'm going to talk to a doctor because she is not in a position to go meet the doctor. So I am going to meet the doctor. Maybe I'm going to approach one of you and then explain that, okay, this lady is in pain. I can hear her scream. She is in trouble. She needs help. She has asked for help. And I want your help. All of you are qualified enough to offer that help. You're all trained in palliative care. Now I'm coming to you and asking you to help this lady. What would be your response? I believe all of you are doctors here, right? I mean, trained in medicine, I guess. Am I right?
Yes, sir.
Yeah. So I am coming to you. I am talking about this lady who is my neighbor. She is in trouble. She needs help. I am asking you for help. What would be your response? Can call her and ask about the symptoms. to ask her to come. Absolutely. So this is the first thing what a doctor does. This is obviously the first thing. Shirley says, I go with you. Shirley, could you explain that a bit? If you're available on the, I mean, if you can get on the microphone and explain that a bit, that's very interesting, isn't it?
It would be better that I go personally with you to the person concerned and know her situation myself instead of hearing through a third party. It makes a lot of difference when you hear a first-hand information rather than listening from another person. That's my point.
Yes, and what this could probably give you more than the call is that you are able to understand the actual situation, the family background. So I think it changes the perspective. It changes your perspective. Like you may end up in a slum where you see this patient in a room with these two kids, nobody to take care of, and the environment is so filthy, and it could be a situation where you cannot even prescribe her medicines because she doesn't even have food. She's not able to feed her children. And what happens typically is when a reference comes, like I come to you, and the first response is ask her to come. Obviously, you would like to see the patient, understand from the patient firsthand. The second option is call her, ask about the symptoms. Now, that is good. I'm not saying it should not be done. But then going there will reveal a lot more. Sometimes calling her and asking her the symptoms would mean that, yes, so Nina says home visit. Thank you very much. So that is exactly what I want to bring in front of you. So one of the things in palliative care is the concept is reaching out to the patient rather than them coming to you or waiting for them to come back to you. Now, this whole story, what I just described, is a real life incident. And that was probably the beginning of palliative care in this place called Calicut, which is towards the north of Kerala. And for those of you who are not familiar with Kerala, this is one of the smallest states in India, down south. And this is probably one area where we have the maximum coverage, as they say, for palliative care. We probably have around 90% of palliative care centers in the whole country. Like if you look at the whole of India and you take Kerala, Kerala has almost 90% of the total number of palliative care centers. And now when all these things began with a real person, a person who just did not even have a degree, who actually saw this patient or heard a patient in pain, took it up as a challenge, wanted to help that patient, went, inquired, got involved. He went to the nearest medical college hospital, tried to find out the right person who can support her. You know how difficult, I mean, you can imagine how difficult it would have been to even identify someone who can treat pain. I'm talking about the 90s, early 90s. But then fortunately, this person caught hold of one doctor, an anesthetist, who was doing some kind of, experimenting with pain relief and with some of his colleagues. And that was interesting. And then what happened was very interesting. These people came together, including a few of the postgraduate students who were also interested, and they formed a new entity. It was a society. It's called the Pain and Palliative Care Society in Calicut. Now, let us review this journey. What does it bring out? Often we see situations where, as medical professionals, you know that there is need for support, there is need for change, there is a gap in the medical or health care that is being offered, but then we are stuck with limitations. Now, this gentleman who was just not even a degree holder went beyond that. He wanted to explore opportunities. He went beyond, he got hold of people, he went and talked to doctors, and then there was something else which happened. You know, we talked about home visit. Now, this is again an actual story which I wanted to bring up. Now, this same gentleman was in the medical college hospital, and he saw this gentleman approaching a doctor in his OP, and this doctor was having a conversation in front of his OP, that room. And then after the conversation, he sees this person walk back and sitting down in a chair, very disappointed. And he went to him and asked him what happened. Then this person started explaining, I wanted some help for my mother who is 70 plus. She is in a lot of pain, not just physical pain. She has got other ailments, and she needs support. So then I came, met the doctor. The doctor said the same thing, you know, bring her here to me, and we'll see what can be done. So then this volunteer, this guy again asked him, so what is the trouble? I mean, we'll get her here, we'll go get her and let the doctor see her, and then we'll find a solution. The person says, no, it's not possible. Even if we want to, it's simply not possible. And this volunteer was confused. You know, what is the problem? I mean, we can bring her here. I can help you out with that. We'll get an ambulance. He says, no, an ambulance won't reach my home. This place is a few kilometers away from the medical college hospital, by the way. And to reach there, you have at least 4 canals to cross. A typical rural Indian village. So, you know how they have these, what you call the bridges across these small canals. I'm sure all of you, you would have seen it at some point of time or the other. Typically, there are wooden logs across these canals, and you are expected to, you know, cross it over. In Kerala, typically it would be a what do you call the trunk of a coconut tree. So he was explaining, you know, I can't bring her here because she cannot walk. She needs to be carried across these 4 canals. And even if I want to, I may not be able to do it because you need 4 people to carry her across these, you know, on these, what you call the bridges, so-called bridges. Now, imagine you are in that situation. Now, you have another situation. You have the patient, she's bedridden. A son comes to you asking for help. You know that you need to meet the person, talk to the person directly. But then he says he is not able to bring her to you. What is the solution? Now, for us, it may be very difficult and complicated to find that solution. But for this gentleman, this volunteer, it was such a simple solution. And he offered that solution straight away. You please go home. The doctor will reach you. He did not even consult with the doctor. He just promised the man, your mother will get medical help. You don't have to worry. You please go home, give us the address. And then this guy actually caught hold of a doctor. And again, a palliative care, someone who was undergoing palliative care, asked that person to climb the back of his bike, took him on his, it was a scooter. They crossed these canals, went home, and offered the care that was needed to this lady. And that was probably the first home care visit, palliative care home care visit. Now, why? In India, probably. So, why I explain the story is, you see innovation happening, and it need not necessarily come from people, trained professionals in the healthcare. It could come from anyone. It could come from the community. And that home care visit changed everything in Kerala. And now we have home care teams going all across the state from different palliative care centers or medical colleges, hospitals, reaching out to patients. Now let us go back to a few of the slides. And then probably I'll take a few more questions. So can we go to the next slide, please, Raju? Okay. The previous slide, please. Raju?
Sir, topics covered or the other slide?
The previous one, yeah. No, sorry. So I think it was the next one. Sorry about it. Next one. Yeah. Yeah. One more. Yeah. So we are not going into deeper into it because we all understand these things. We have already learned about these things. So it's about care for the patient and the family, and it involves this interdisciplinary approach where, and again, across multiple healthcare settings. So that is where the home comes into the picture, the hospice comes into the picture. Next slide, please. Team members. Again, we are familiar with all these people, but I want you to focus on this last set of people, that is the family and other caregivers. Now, this is something which we often forget, because whether we like it or not, with all the healthcare infrastructure in the country, if you and me, we have a fever or another healthcare problem, the first and the foremost, the person or the team that is going to provide me care is actually the family. And irrespective of whether we consult a doctor or not, still the family has a role to play. And we should not forget about these family and other caregivers, and not forget to include them as part of the care team, along with the doctors, nurses, social workers, etc., etc. Next. So basically, yes, anyone who can improve the quality of life of the person. Yeah, next. We have gone through this. So you also agree with me that I have a role to play, just like you. And so it's palliative care is everyone's business. Next. So all these things we can go on and on. We can spend hours together, but then we have time limitations. So if there is anything that specifically you want to raise a question on, feel free to do so. I'm okay. I'll just keep the chat on so that, yeah, you could put a question in the chat box also. So it could be a standalone facility. When I say we are talking about a palliative care service facility, it could be standalone in the sense just like we have it in Pallium India. We offer just palliative care, but it could be also part of a hospital, maybe a professionally trained team in palliative care offering the service from a hospital, or it could be led by the community also. Next. So these are things that you can find on the net. There are standard audit tools and all those things. Now, why I'm not going deep into these things, it's because so these are things you can read upon and then you can understand, you know, what are the basic things. And I'm sure you must have covered most of these things in your earlier sessions also. So it involves that whole patient assessment, documentation, all those things which are considered as essential components. And of course, opioids. Now, I believe you have had a separate session on opioids availability, how to ensure the proper documentation and you know, the special care that you need to give while handling opioids and all that. So next. Again, we talk about the team approach. So we need to have a team that is trained in palliative care and at least one doctor, which is very essential. Then it's about engaging community and healthcare professionals. So engaging the community is a very essential component of palliative care delivery, which is accepted throughout the world now. Probably Kerala gave a model to the developing world at least, because until it started off in Kerala, there was no model available for palliative care delivery for the developing world, because it is very expensive, considered very expensive at least. It was restricted to the Western world, where you know, they had all the financial or muscle or the strength to offer that kind of care. But then once the community got involved, it changed everything. So yeah, regular team meetings. Next. So these statutory requirements become even more important, especially in the case of individual or independent centers. So if you're part of a hospital, it becomes easier because there is a team who is supposed to focus on that, ensure that all the proper licenses and other things are in place. But if you're trying to do it on your own, I don't know how many of you would like to have a start a palliative care center on your own, but make sure that you meet all these statutory requirements, have all your licenses in place. In India, if we are talking about the Indian conditions, what we need, what is known as a RMI, registered, sorry, what is the full form of RMI? Recognized medical institution. Is that correct, Raju?
Yes, sir, yes.
Yeah. So now that is again, they have certain requirements, like at least the doctor should be trained in palliative care, at least 10 days training, I believe. That is a minimum requirement. Of course, it is debatable whether that is enough or not, but that is what is required. And yeah, there are other things like how do you handle all these medical waste and all those things. But these things are more important if you are trying to set up something on your own. Next. Again, something which is important if you're running a not-for-profit center. So you need to have separate bank accounts. Now, often people start off with these kind of activities with the best of intentions. Sometimes you land up in trouble also. Like for example, you may start off with your own bank account where people are willing to support you with money. You may get it into your bank account, try to manage the requirements from that. Because it is money coming into your account, you may end up having to answer a lot of officials about the source of money and all those things. So it's always better to keep a separate bank account for such public. So this is applicable only if you are looking at donations as part of if you have a fundraising activity and you're raising it from the public. So books of accounts, very important if it is in a separate entity.
December.
Yeah.
So you can continue.
Yeah. And there are reports that may need to be submitted at regular intervals. Like for example, if it is a case of morphine, you're supposed to give an annual report and then also requests for approval for stocking the particular quantity which you need to for the next year and things like that. So those kind of things are very, very important because if you're not ensuring some of these things, you could end up losing your licenses, or it could be even worse in some situations. You may need to run after the police department and trying to solve things also. So, and yeah, training, which is very essential. You need to have the people with the right kind of training, certifications. If it is a nurse, probably a BSc nursing degree or whatever it is, those things will again depend. It will again vary from place to place. So make sure that you are aware of what is the requirement in your area, what are the prescribed norms, and then make sure that you follow that. Next. Now, yeah, thank you. So, as we discussed earlier, it has been almost 30 years since, okay, should we have a lawyer in this team? Thank you, Nina, that's a good question. It helps sometimes, especially if you are trying to set up a not-for-profit organization on your own, or even for-profit, if it is a separate entity. At least you need a consultant. You may not have a lawyer as part of your, what do you call, if it is an entity like a trust, I wouldn't say you should have a lawyer as one of your trustees, not required. Or if it is a society, I don't think you should have a lawyer as one of your managing committee members. But definitely you need someone whom you can consult on a case-to-case basis and get things clarified, especially around government norms, the statutory requirements and all those things. It is to be helpful, yeah. So even after 30 years, we know that the penetration in India is very low. Can someone give me a figure? What is the percentage when you talk about PC coverage, palliative care, or maybe the percentage of population who have got access to palliative care in the country? If you look at India as a whole, any figures?
You can type it in the chat box.
Yes.
Approximately how much is the palliative care coverage in India?
Yeah. You can just make a wild guess. It's okay. It's, we are not going to charge you for that. So feel free to put in whatever. Very less in North India. Gopal says 10%. Navish says 1 to 2. 5. Yeah. 2. Okay, so generally we are at more or less clear. Parvesh says 30%. Parvesh, so that's very ambitious, unfortunately. So it's at least in the single digit, this thing. It's not even 5. That is what we understand. It used to be considered 1 to 2%, but now they say it's gone up to 4%. But of course, these are figures which cannot. I mean, there is no substantiative or evidence for these, but more or less that's the figure that they quote. So look at the situation. After 30 years, we are still talking about 4 to 5% coverage. So that is, why is it so? I mean, a lot of factors are there. Of course, we all keep cribbing about our population density, poverty, and all those things. Yes, these are important factors, but there have been other factors as well, like, for example, availability of opioid. As you all know, there have been serious, severe restrictions on the availability as well as the procurement, storage, all those things. So these policies have changed over a period. Now it is much easier, but still it is not as easy as in some of the other developed countries. So long way to go, and we still don't have a proper policy for palliative care. Even if you look at the entire country, still we have hardly 3 states who have declared a palliative care policy: Kerala, Karnataka, and Maharashtra, I believe. Dr. Sunil Dutt. Okay, Parvesh says, does Pallium India provide any technical support for starting a palliative care center? Yes, of course. Parvesh, feel free to get back to us. That is one of the main agenda for items in the agenda for us in Pallium India. We are focused on helping other institutions, teams, individuals who are interested in providing palliative care, help them, support them in whatever manner possible. And we prefer to work as a catalyst and making that happen. So we can provide technical and other support. Let's have more discussions and we'll identify which are the areas where we can work together. So I was about to ask Dr. Sunil, are you aware of any other states other than Kerala, Karnataka, and Maharashtra who have palliative care policy in place now? State level? Okay, I think. Okay. And of course, lack of institutional interest. Generally, hospitals shy away from providing this, mainly because they see it as a not too lucrative domain, I would say. So you could make much more by providing for a what do you call a heart transplant, or putting a person in ventilator for a few days. It is much more financially viable than providing palliative care. So at least that is a perception, which could be wrong sometimes. Anyway, so that's again debatable. Next slide, please. Next. Uttarakhand, there is Ganga Prem Hospice there. Yes, in fact, we work a lot with Ganga Prem Hospice in Rishikesh. We have had a lot of combined programs also conducted, including training programs. So we work with a lot of other institutions like Ganga Prem Hospice, and we work with other institutions, government bodies, state governments, to help set up palliative care facilities, policies, all those things. So Ganga Prem is an example. In fact, it's a good example for palliative care in the North region. I must say that. So healthcare delivery, as we have already discussed this, at the macro level, you have all these government healthcare institutions, hospitals, whatever. But still at the micro level, it's still the family, which is the first level of care provider. Next. But often what we miss is this meso level, that's the level in between. And the key lies in unlocking this social capital, which is still untapped, I would say. Now, what is the social capital? We're talking about lot of challenges that we see in setting up and offering palliative care. It will just disappear. Am I audible? It says my internet connection is unstable.
Yeah, you are audible.
Okay. So this is a huge challenge. I mean, it's not easy, but once we unlock this, a whole lot of other things will automatically be resolved. Like for example, everyone is concerned about how do we find the funds now to actually provide palliative care. We in Kerala see a lot of this big challenge being solved by people, the community themselves. If there is a person in need of medical care or support, the community steps in, raises the money which is required for the treatment or the care, and then gets the problem solved. So that's just an example of what the community can do. Next. So this is again something which we are all familiar with. Like I mentioned before, I belong to this category. At least that is where it all started. So next. So there is a story. This gentleman actually, his wife died of cancer in November 2004. Now, it was in 2002 that she was diagnosed with cancer, but then it was too late by the time. It was stage 3, and she couldn't. I mean, nobody could help her get over that. Can someone here give me an idea about what this person would have gone through when she was finally diagnosed? Now, prior to this, at least 3 years prior to that, before she was diagnosed, he had gone to almost all the major oncologists, all the major hospitals in the city, and none of them were able to identify that it was cancer. And in fact, when she really was, or finally what happened was, as I understand, there was some specific test which was required, which should have been, it would have been a basic test which should have been conducted, but then the doctors or the whoever was handling the case, they missed it, and because of which the diagnosis was delayed. Now, can you just imagine yourself in that situation and what that person would have gone through? I mean, everyone is welcome to comment. You can use your microphone if you so wish. So almost 2 to 3 years of running around, going, meeting doctors, healthcare facilities, and then that person is diagnosed, and then she dies. Suppose you were in that situation, what would you have felt? Or what would be your reaction? Anger, frustration, feeling helpless. Namrata, thank you. Yes. Anything else? Loneliness, absolutely. In fact, until retirement, he was staying alone. He was working in different parts of India, and after retirement, he wanted to spend some more time with her, and that is when all this happened. So, and as he was feeling very lonely. Anything else? So anger, frustration, and this is something which we often see in India, especially people getting angry, and sometimes it leads to even manhandling of the doctor or some of the staff in the hospital, losing faith in medical professionals and the medical healthcare system in general. Parvesh, you're right. You lose faith, you have a lot of anger, frustration. Um, Apart from all that, often something that happens, like, can you imagine what the doctor would have told him when actually she was diagnosed? Finally, when she was really diagnosed with cancer, what would have, what, you can just imagine what the doctor would have told him. Can anyone guess? Any comments? We can't do anything now. Absolutely, yes. Apart from that, it's too late. We can't do anything now. That is a standard answer that we keep hearing. Anything else? Okay, so well, let us stick to that. Namrata, when the doctor says it's too late, yes, if you had come a bit earlier, how does it make you feel? When the doctor says, if you had come here a bit earlier, or says it's too late, how does it make you feel? Remorse, frustration, guilty. So he has been taking her to different places. He has done all that he could, and still, he ends up feeling guilty. And this is something which we go through. Now, ready to tell the doctor about. Okay, so thanks, Gopal. So yes, sometimes we feel that. So now, in such a situation, how would you react? Typically, what would be your next course of action? So I would probably go and tear the doctor apart. Yes, you are in denial, you go through that stages of grief. Absolutely, that is there. But then I also feel like doing something. You feel so frustrated, you're angry at the system, you're made to feel guilty. So typically what happens is you just go and take it out at the doctor or the healthcare system. That is one way of doing it. Now, there are other possibilities, like sometimes you may take a legal course of action, you may file a suit, and then that is another way of getting over your frustration. But this gentleman chose to do something different. What he did was he decided, I'm not going to go after the government, I'm not going to go after the healthcare system. what I'm going to do is make sure that someone else in a similar situation doesn't end up with the same experience, a similar experience that he went through. Now, why I explained this story is most of the people who come forward as volunteers will have a story. It need not be as horrible as this one. Yeah, so yes, Parvish, go to paths for magical remedies. That's all prior to this death happening. Now, once that person is gone, then you are still left with all this anger, frustration, guilt, remorse, everything. So that is when you have a choice to make. You have to go forward. You're feeling lonely. You have all these problems. But then do you fight the system? You go after the medical care, medical facility. You go after the healthcare system. That is one choice. Or then you decide to change the system or see how you can be involved in helping someone else. So that was the choice Mr. Nair made, and a volunteer was born. Now, there are so many people around us who have gone through these kind of experiences and who wants to contribute, who wants to do something about it, who wants to help someone avoid such a situation. So those people, that is where, just as we discussed earlier, the social capital, let us not forget these people. Next slide, please. And where all can they contribute? Next to what is impossible, it's anything that you can think of. Now, patient care, if they have some kind of training, they could do a bit more. Or even if it is a doctor or a nurse coming forward as a volunteer, then they can do a lot more. They can help with advocacy, fundraising, administrative work, anything that you can think of. But then we have to be clear about a few things here. We should ask these people to undergo proper training, at least go through a proper volunteer training program. Because if a proper training is not provided, sometimes you may end up actually causing more harm. It may not be your intention, but that might be the end result. Like for example, a simple example like hand hygiene. I may not have that training, how to wash my hands. Now, of course, with COVID, everything has changed. Everyone knows how to wash their hands, how to the different, the process through which you have to clean the entire hands, the fingers, everything. So, but then if that training is not there, what happens is you may actually be carrying some infection to a bedridden patient who is already vulnerable, and that might be the reason that that person ends up losing his life or making things much worse. So that's one. Sometimes it may be about communication skills. Like you may want to help someone out, but then the words that you use, the choice of words, or what you actually meant and what actually the other person understood could be two different things, and that can be disastrous. Sometimes in the process of giving more confidence to a patient or the family, you may end up doing just the reverse. So it may not be just confidence; it might be false sense of confidence also. Sometimes, when you've gone through all these training programs, you must have already realized the kind of mistakes we often make when we deal with these kind of situations, especially around communication. So then it's about identifying areas where these people can contribute, and also getting a clear idea about the specific days and time. Because see, if you want to help someone, there are three things that need to come together. Can anyone tell me what are the three things? Three things that need to come together to actually make a difference, to make something happen, or to really help someone. So, anyone? Not just about palliative care, it could be generic for other things also, but especially in palliative care. We said, should I wait or just go for it? Any guesses? Yes, willingness to do. That is the heart, I would say. Then what? Genuineness, dedication, consistency. Yes. So the second most important thing is knowledge. Willingness is heart. Knowledge, yes. Limbs, yes, absolutely, Gopal. The limbs, it's most, I mean, I put it as, the skills. So you need all these things together. It's not enough that you have the knowledge. If without the heart, the dedication, you cannot do. Yes, Sunil. Yes. Can we stop? Yes, we can. So that is also there. So the head, the heart, and the limbs, the knowledge, the passion, and the skills. Yeah. Next. Next. So this is something which you have to keep in mind. If you try to entertain people like me, you should also understand what makes me do it. Like, for example, why should I spend this time talking to you? This session, for example. So there is something which I want out of this. And if you are not in a position to offer that, then I may not be willing to continue with it. So what are they looking for? What makes them do it? If we can understand that better, we can help them better, or ensure that they are contributing and continuing to contribute. Next. And again, it all depends on the local culture and individuals also. So again, coming back to collaboration, I think we have gone through this earlier. Next, it's about teamwork, right? So there's a lot more that could be done if we really understand collaborative working. If people can work together, we can solve a lot of big problems than when we are trying to trying to solve problems on our own independently. Next. So what it does is you can bring together ideas, you can increase productivity. There is always that scope for innovation. Like we started off with an innovation, an example of innovation about home care visit, right? That gentleman who thought of taking the doctor to the patient's house, that was innovation. And that is how the home care, the concept of home care visits started off, So you can have more productivity, you can have innovation when we have different brains coming together and collaborating. Next. So things are changing. There is a lot more happening in this scenario in palliative care. We have more NGOs, government is also involved. Even some of the private hospitals have started offering these services. So there is much more scope for collaborative working. Like what we don't have, a medical hospital, medical college hospital may have. Like Pallium India actually works with the local government hospital in offering palliative care to the patients who come there. So next. So what it means is we can reach out to a larger number of people. Like these link centers, what you see, these are independent units with whom Pallium India works. Sometimes it may be offered, it may be offering just medical attention for the patient. Sometimes it involves providing food kits for families. Sometimes it may be just nursing care. Sometimes it would be just training. So whatever it is, it's about increasing the coverage, reaching out to more people. By getting more collaborative partners, we can increase the coverage, reach out to more people. Next. So we'll skip this. Next. And when we talk about collaboration, we should also understand that we are all individuals, human beings. We have our own selfish interests. And just because there is a common cause, don't imagine that these selfish interests would just disappear. Now, what that means is we have to understand the other person's requirements also. Next. And on top of that, you also need leadership. I mean, now the volunteer whom I was referring to in the beginning, he was a leader. He did not stop just going and inquiring about the pain that the lady was going through. He wanted to make a difference. He went out and tried to find the solution for that problem. Now, he is not a medical professional. He doesn't have that background, but then still he can be a leader. So it's not necessarily that in this healthcare system, only doctors can be leaders. It could be anyone in the system, but then we have to understand that there need to be leadership to take things forward also. Next. So it all starts with this understanding, the I. The previous slide, please. Just one step back. So it starts with the process of inquiry, questioning yourself, what, when, how, those kind of things. And from there, it leads to innovation. You might be able to find innovative solutions for the problems that you're seeing. These solutions, the process that you go through, or someone else sees you solving these problems with an innovative approach, that inspires more people. And that inspiration leads to a bigger impact. So that's what happened in Kerala also. And that has inspired more people from other parts of the country also to step in and try out what we have done here in Kerala, in this little state. Next. So it all started probably from an individual or certain individuals, and then it influences the community gets involved, then the society at large. So this is the ripple effect that we want to see, and I think we will stop here. This is where you and I, each one of us, can make a difference. It's only about working together. It's about collaborating and finding solutions for these the big problems that we have in front of us. So because of limitation, we may not be able to go into the fundraising and the advocacy part of it. But I am open to take any questions on that also. Yes.
Thank you, Binod. So I'm not sure whether you have seen one question in the chat, whether Pallium India provide technical support, or have you taken that question? Because I was on another call, so I don't know.
Yes, I have.
Yeah, okay.
Yes, I have clarified that. Anything else?
Anybody else want to ask any question regarding organizing palliative care service? Because he is one of the experts whom we can ask.
Thank you, Shirley. that's very rewarding. So that inspires me to do this more often. Be with people like you, share what little knowledge that I have.
So I'm Dr. Divya from Bangalore Command Hospital, sir. Dr. Rajgopal sir told to join this. We are Dr. Sir Bommaya from Bangalore. He had visited Pallium India. He's keen
Yes.
to start a palliative care in his 15-acre place in rural. So
Yes.
for can we get? He was thinking how to start, what to do. He wanted Pallium India people to visit. So he spoke to sir. Then sir told Shalini is there. Who else you want? She'll be there for support. So but if he needs technical support with the nurses and social workers and all, will Pallium India, like if he's ready to pay, will Pallium India can provide the nurses and all the trained personnel professionals? Like we will go as volunteers, like me, Shalini and other people, but he wants a full-time volunteers and all. Is Pallium India, like, can they provide trained this one?
Yeah, absolutely, Divya. See, in fact, I met him while he was there in Trivandrum. I have met.
We're going to his place tomorrow. He's invited to see his place there in Kanakpura. So
Yeah.
he was waiting for Pallium India people to come and see.
So unfortunately, this COVID situation has changed a lot of things. I mean, changed the plans. So yes, we can help. I mean, we can work together, I would say. It's on all these fronts, like training. Absolutely, that is one of our focus areas, I would say, as far as Pallium India is concerned. Not just that, we can connect uh, other resources, I would say, like trained doctors, nurses, people who have already undergone training here in Trivandrum and in other parts of the country also. So
we spoke to Amrit Kadam sir also, who is the deputy registrar in Rajiv Gandhi University. Even Dr. Rajgopal sir only told to meet him as well. He wants to start in Bangalore Medical College. There also he's like, it shouldn't stop. So we need a trained person who can just keep running for a. They will pay, and then he wants it to go on. So all that, so many people are wanting, but that's what to set up, and we are trying hard to somehow increase the awareness in Bangalore. We are speaking to Sanman volunteers group, calling them. We are doing a small bit, still a long way to go.
absolutely.
Dr. Divya, there is a doctor at Bangalore who got trained by us, and probably she might be interested. So if you need any help, please contact us.
Yeah, Dr. Amrit Kadam asked for this one also here, like for the fund and all, how do we get? And also from Pallium India, we requested Smriti, and she sent the policy and all, Karnataka state policy also we sent across. We'll get in touch with him again, and he's agreed to. We are requested if he can give talks in colleges, since he's a registrar of Rajiv Gandhi University. So he told, okay, I'll make sure I'll give a letter to all medical colleges. You all can go and talk in the medical colleges to create awareness and all. So we're still doing a small part.
Yes. So we'll be in touch, Divya. I'm sure we can work together and find
Thank
solutions.
you. Thank you.
Okay, there is one question in the chat. Whom to contact for organizing awareness seminar for volunteer organizations like Rotary?
Yeah, there could be people whom we can connect with. Can you just note it down? I think someone from Trivandrum, Dr. Sunil, I'm sure Babu or someone would be able to identify someone who is has been providing these kind of conducting awareness classes, and definitely I think we could also ask what's her name, or Shalini.
Yeah, if it is online, even we could do that,
Yes, online we could do. Even otherwise, if it is physical, someone like Shalini could also help them. Dr. Parvesh, yes, absolutely, we can. We will be able to get you connected to someone who can.
Is it paid, sir? Is it paid? Like in our, I was spoke to the commandant's wife, and to give a talk to the ladies of the like AFA is an organization, Air Force Wives Welfare Association.
Yeah.
So I thought if we can motivate those ladies, if they can get trained, they can act as volunteers. The Sanman group, which is there in Bangalore, it conducts a IAPC trained course or something, but they charge 1,000 or something for the certificate and training. Does Pallium India do it for free, so that because many volunteers may not want to pay, they are ready to dedicate the time but may not want to pay. So if the ladies or someone are interested, can any training Bangalore like any training is there? They provide 16 hours training in Sanman, but it's a paid one. It's not free.
Yeah, absolutely. Yeah. So
If
it's,
food is taken care of, if food and the organizing part is taken care of.
no, it's not. See, awareness programs are generally free. I mean, we can organize something free. That's not a problem. The other is mostly, I mean, the 1,000 rupees thing mostly is for training sessions. Where
Yeah, train session, certificate work.
this is about creating an awareness about palliative care, and these clubs, the Rotary, the Lions, and similar ones. I think those are very good entry points, and they can also contribute a lot. They can support
Fundraising and other things.
Yes, yes.
Do you have a slide, sir? What you all use for motivating the general public, the volunteers training ke liye, what do you use? Do you have that English version of the slide? If we can use it, we are thinking. We in Bangalore, we have to go to all places, try where to volunteers. So, do you have something for the volunteers training? Any slides you all have?
There are slides which will be available. Raju can surely help you with that. She can share those volunteer training. Raju, you must be having those slides, right?
Yes, we do have materials for volunteer training program. I will talk to Babu, who is in charge of these programs, and I will surely get back to you, Dr. Divya.
Yeah, please. Yeah. My mail ID, I think you'll be having Dr. Divya for. I'll send
Yes,
in the
yes.
chat. If
Yes,
you can,
If it's
so it will be
online, I
great
think
help.
we can bring
Yes,
in
sir.
better resources also. If it is online, I think we
Yes,
can
sir.
also bring in better resources. Yes.
Yes, sir. Yes. Thank you.
You're welcome. Thanks. Thank you, Divya.
Video നിർത്തിക്കോണേ.
Anybody else?
Okay.
Anything to ask? Okay. I think